Hello, everyone, and welcome to another Facebook Live with the Train with Trust Project and Dr. Sue Dyson. I am Megan Phillips of the Train with Trust Project, here with Jody Ambrose, co-founder of the Train with Trust Project. And as always, we are joined by Dr. Sue Dyson, who is a world-renowned veterinarian, equine researcher, and author. And today we're going to be recentering our discussion on the Ridden Horse Pain Ethogram, also called the Ridden Horse Checklist. And we're going to be taking a deeper look at behaviors of the face and face region, so facial expressions and behaviors involving that area, some additional behaviors as well. So I am going to go ahead and share my screen and pop up our PowerPoint that we'll be going through here today. And we'll have some information on here if everyone wants to take notes about how they can find out more information about the 24 behaviors. And we have articles and links to webinars all on our website. You can find us, the Train with Trust Project, at trainwithtrustproject.org. And you can find us also, the Train with Trust Project hosts the 24horsebehaviors.org website, which is where all things are focused on 24 behaviors. So you can find us in either of those locations. We are a nonprofit organization, and we are so happy that we can provide all of these materials free of charge for everyone, including all of our Ridden Horse Checklist forms that you can use, our field guide to the 24 behaviors for you to download with illustrations of each of the behaviors. We can provide all those things for free. So if you're enjoying our work, you're enjoying these conversations, please consider a donation for us. And with that, I am going to turn things over to Jody and Dr. Dyson to discuss equine facial behaviors. I will be in the background, so if you have any questions that you'd like to ask, go ahead and pop them in the comments, and we'll see if we have an opportunity to address those during the live, or we can follow up with you afterwards.
Okay, so I think you'd have to be living under a rock to have missed the fact that the horse industry is now having an increasing number of conversations about equine welfare and how to identify and improve equine welfare, including specifically recently the FEI included an independent panel from our Heltonsworth, which is a Swiss welfare group, at the World Cup to evaluate the warm-up particularly and the condition of the horses. Basically, they had trained people there to evaluate and inform the FEI about the conditions of the horses there. It's a start, and I'm interested to get Dr. Dyson's take on that whole process, but there's many of these developments happening all over the horse industry, and I think people agree that there needs to be more. But it brings up the question, we like to talk a lot about not one side of the issue or the other, or right or wrong, but how do we discuss these things? How do we use language? How do we use data to evaluate these things in a way that can be consistently observed, measured, and potentially changed if needed. So today we're going to talk about facial expressions because that seems to be something that comes up a lot, particularly things involving the mouth, the tongue, the ears. I think are something that a lot of people are aware of and pay attention to. But there's also the eyes, the facial muscles, all sorts of things, complex things going on in the horse's face. And I think they are some of the more complex and difficult behaviors to identify and pick out for the average person. And yet they are almost a third of the 24 behavior Ridden Horse Pain Ethogram. So I'm really excited to talk to Dr. Dyson today about specifically those facial behaviors what they are, why they were chosen for the ethogram, which ones were left off, and whether there are others that need to be paid attention to, and how we can get better at spotting these. So, Dr. Dyson, can you talk a little bit right off the bat about, just give us a little refresher about how the ethogram is used and what constitutes a significant finding using this data?
Well, we just have to backtrack slightly to say that the Ridden Horse Pain Ethogram, or the Ridden Horse Performance Checklist, was developed by comparing the facial expressions and other behaviors of clinically pain-free horses that were working very comfortably, of a variety of different ages, from young horses through to advanced level horses across disciplines. And they were compared with those horses which were showing signs of musculoskeletal pain. And those behaviors that were selected for the ethogram were those behaviors which we saw much more commonly in the horses with discomfort than the non-lame horses. It's also very important to realize that for each of the 24 behaviors that comprise the Ridden Horse Pain Ethogram, there are potentially multiple different causes, and therefore we cannot consider any one behavior in isolation. And it is the total score out of 24 that is ultimately of importance for us to recognize whether or not there is musculoskeletal pain. And if we have a score of 8 or more out of 24, that indicates that the horse does have musculoskeletal pain. It could have a lower score than that, but still have musculoskeletal pain. But if it has a very low score, like 0 to 2, the likelihood of it having musculoskeletal pain is small. Although it could be said that if the horse is constantly opening its mouth and not showing any other behavior, one would have to ask, well, why is it constantly opening its mouth? And that could be multifactorial. And we'll talk a little bit more about that later. So we're going to focus on each of the 20 of the facial markers in turn. So if we start with the first one, and this is the ears rotated, well, that's one ear or both ears behind a vertical position. And we have to differentiate between the horse that's got its ears forward, the horse has got its ears rotated outwards to the side, and the horse has got its ears back. The horse's ears are incredibly mobile so that it can pick up sound from all sorts of different directions. They're much more mobile than our ears are. And horses also have the ability to hear sounds which are out with our sound hearing. So they can hear sounds of much higher frequency. So they may move their ears in response to sounds that we are unaware of. But generally speaking, that's not having them back for 5 seconds or more. And particularly if we see the horse during a work period having the ears back for multiple times for 5 seconds or more. I often hear riders say that, oh, well, my horse puts its ears back because it's listening to me. But the me is not constantly giving verbal cues. They are giving cues through their leg movements and through their hand movements and maybe their body movements, not generally speaking continually through their use of their voice. So to say that the horse's ears have to be back in order to listen to the horse's cues makes no sense. Now, if you suddenly say, whoa, they may move their ears slightly, but they're, again, unlikely to be back for 5 seconds or more. So there has to be a reason why they're back for 5 seconds or more. Now, when we see race horses, as we see in this picture, galloping alongside each other, they often have their ears back. This is what they do when they're galloping upside each other. They rarely have their ears forward. So you have to look at the circumstances in which you're evaluating a horse. However, if you take horses that are, for example, moving around within an arena and just passing each other, Most horses don't put their ears back when they're passing each other. They keep their ears forward, or they keep them rotated to the side. So in most horses that are working on the flat and are jumping over fences individually, their ears will either be forwards, upright, or rotated to the outside for their normal posture. Let's go to the next slide. Although the Ridden Horse Pain Ethogram was created to be used during horses working on the flat or even out hacking, we can observe horses' behaviors when they're jumping. And in the picture on the right, you can see a horse jumping, landing, its ears are forward, its eyes are wide open. It's a nice picture. But if you look at the horse on the left, you can see that its ears are back behind a vertical position. And if you look carefully, the eyes are semi-closed as well. And this horse repeatedly landed with its ears back like this. And I'm quite sure that this is a manifestation of discomfort during landing, because I don't think that normal horses, when they're jumping alone, and we're not talking about a steeplechase horse jumping with other horses, when they land alone, mostly they have their ears forward, as we see in the horse on the right.
Can I just ask, do you think that the bonnets have any effect on the ear position?
I think that's a very interesting question, because I listened to a debate at the European Union, which took place last week, when one of the presenters, who works for an animal welfare organization, suggested that the bonnets can limit ear movement. I've seen no indication of that. So, the bonnets vary in their stiffness, but I don't think if a horse wants to put its ears back, the bonnet can stop it putting its ears back. Mm-hmm. What I will say is that if you have a bridle that fitted without the bonnet, and then you put the bonnet underneath the bridle may then be too tight, and that in itself can cause discomfort, which may alter ear position.
Oh, that's interesting.
So I think one always has to bear that in mind. But I don't think that I've seen any evidence that bonnets will restrict ear movement.
Interesting.
Okay, so let's move on to the next behavior, which is the eyelids being closed or half closed for between 2 and 5 seconds. And this is something that's not particularly easy to see unless you're reasonably close up to the horse. But if you're standing, for example, in the middle of a circle that the horse is doing, say it's doing a 20-meter diameter circle and you're standing in the middle, this is something that you'll be able to see. And we're differentiating this from blinking. I think that rapid blinking is something that we see in association with discomfort, but this was not part of the Ridden Horse Pain Ethogram, because the Ridden Horse Pain Ethogram was initially developed using video recordings, and the perspective of the horses was such that you couldn't really measure the blink rate. But I think repeated rapid blinking generally is a sign of some form of stress. And remember, pain creates stress. And I think if you look at the photograph of this horse, the chestnut horse on the left, you can see that not only are the eyelids closed, but the front of the head is behind a vertical position, which is another of the behaviors of the 24 Ridden Horse Pain Ethogram. But the position of the head is not something we're going to be considering today.
Yeah, which raises the point that, these behaviors don't happen in a vacuum. And one of the reasons that it can be, that we used illustrations in the field guide is so that we could show examples of these behaviors without a lot of other contexts, because in real life, that's not how they happen, right?
Yeah, exactly, exactly. And note that this chestnut horse has its ears rotated outwards. These are not ears behind the vertical. These are ears rotated outwards, so that you can see the opening down into the ear. Okay, let's consider also the eye. And what we call the sclera is the white of the eye, and that's around the periphery of the horse's iris. And when we're considering this as a behavior, I think we have to first of all, assess the horse before we see it ridden, because some horses, and we're going to see an example, have small irises, and therefore the sclera can be seen at rest. One other thing that we need to be aware of is light reflection. So if you look at this chestnut horse's right eye in the top left-hand corner, you can see it looks brighter or almost white, but that is reflection of the sun on the horse's eye. So this is not exposure of the sclera. Let's go to the next slide. And here, these are two pictures of the same horse. So on the left of the screen, you've got the horse's right eye, when you cannot see the white of the eye or the sclera at rest. Whereas in the right picture, you can see the horse's left eye, and you can clearly see a rim of white around the iris, and that is the sclera. So we can apply the behavior exposure of the sclera to the eye on the left, that is the right eye, but we cannot apply it to the eye on the left, which it has the eye on the right, which is the left eye, because you can see the sclera at rest. So if we go to the next slide, this was a horse in which the sclera could not be seen at rest, but you can clearly see in the right-hand corner of the horse's left eye, there's a large patch of white, and that is obviously the sclera. And just to the left of that white patch, you can see a very small, brighter area, and that again is light reflection on the horse's sclera. So that's right, beautifully picked up there, that small little reflection. Other things to note about this horse is that the horse's head is behind a vertical position. The lips are separated. I can't tell from this photograph if the teeth are properly separated or not. And I can clearly see the left ear, but I can't see the right ear. So the horse's head must be tilted with its poll to the right and its nose to the left. And we can also see that the horse is in a crank cavesson noseband, which is fairly tight. And the question that always arises in this circumstance is, would the horse open its mouth more if that noseband wasn't so tight? And it will be interesting to see, with the introduction of the new FEI guidelines for tightness of nosebands, with mandatory testing now on the front of the horse's nose, whether or not we see a change in frequency of mouth opening in competition horses. I was fortunate enough to be at the badminton 5-star 3-day event last week and watched a large proportion of the horses either warming up for dressage or doing their dressage test. And I would not have said that I saw any change in the frequency of mouth opening compared with the previous times when I have actually collected data at 5-star 3-day events.
And that's a great example of why we have these conversations about the specifics and the language that we use to describe, these ways of measuring, because that's exactly the kind of thing that is important, is when we make these changes, do they have real world measurable effects?
Yes. I mean, I think that it's good that the equine industry is thinking more about welfare, and changing legislation and inviting external bodies to advise governing bodies. The question is, do the governing bodies make the right decisions about what to do or not? And that's a different debate. So let's move on to the next slide. And this is just to emphasize that if you just see the sclera exposed on one occasion, that doesn't count. The definition is the sclera exposed repeatedly. So we've got to be seeing this on more than one occasion. So if I'm looking at a horse, I use a score sheet, and I'll put a tick for one, and I put another tick for the next time, and another tick for the next time, so I can document the frequency of occurrence during the work period. Okay, let's move on to the next of the facial expressions, and this is the one that most people find most difficult to recognize, but many people say once they've seen it and they realize what they're looking for, they can't unsee it. So here we can see a horse with an intense stare. So the horse doesn't look focused on anything. Some people understand it better as a glazed expression or being zoned out, not, as I say, not focusing on anything particular. And this has to be present for at least 5 seconds. With the bay horse on the left, we can again see that we've got some other features too. The ears are rotated outwards. They're not back, but the mouth is open with separation of the teeth. And we can see the tip of the tongue out to the left-hand side of the horse's mouth. And we can see that the bit has been moved through, so we can see more of the cannon of the bit on the left side than we should be able to. So once again, this is showing that we often will see more than one behavior occurring simultaneously.
Do you think this behavior is harder to see in certain horses? Like certain horses' eyes look more intense just naturally, and so there's less of a differentiation?
I think people get a little bit confused in some respects, in that many of the horses which have an intense stare will have this kind of V-shaped tension in their muscles above the eye. And I think we can see that in normal horses. It has been described by others as potentially a sign of abnormal tension, but I've seen that lots of horses at rest, even when they're focused on something that they're really, really interested in. So I think that some people get a bit confused about that. So going back to your question, I don't think that I don't think it's more difficult in some horses than others.
Okay.
It's just getting in tune and looking at what is normal versus abnormal. And if you were just to go, no, I can't. We'll see another horse which looks which looks different, and I'll try and point out again the differences. And again, this is the definition is this has to be for 5 seconds or more. So now we're going to move on to talk about the mouth. And I think it's really important that when we think about behaviors related to the mouth, we are aware that, of course, if you've got any lesion or damage within the mouth, then that's going to create potentially discomfort within the mouth. And therefore, there may be all sorts of behaviors which result from there being discomfort in the mouth. So sharp teeth can impinge on the lining of the horse's cheek, and just pressure by the cheek and tense facial muscles on those sharp teeth can create pain, even if there's not abrasion of the lining membrane or the mucosa. But as in the top right picture, sometimes we will see actual disruption of the mucosa. So we've got ulceration of the mucosa. It's what we call the buccal mucosa, highlighted by the big white arrow. And of course, those can cause discomfort, and of course, they can create abnormal behavior related directly to the mouth, or to movement of the head, or to the position of the head. And then we have to think about the corners of the horse's mouth. So in the bottom right picture, we can see a big crack in the commissure of the lips. That's the corner of the mouth. It's obviously been going on for some time, because if you look above the pink crack by the person's rather grubby finger, we can see that the tissue is rather white, that's shown by the black arrow here. And that reflects some abnormally hard fibrous tissue, reflecting that this has been a recurrent problem with this horse. We then have to think about the tongue and the integrity of the tongue. The horse can have lacerations of the tongue, it can bite its tongue, and that too can create oral discomfort. Going back to these lesions at the corners of the horse's mouth, we always have to think, well, what was the cause? Was it aggressive riding? Was it the bit that didn't fit the mouth? Or were there rough edges on the bit that created a sharp edge that resulted in a tear in the horse's mouth? Or was it multifactorial? Other problems related to the teeth can be more subtle or more difficult to detect. And one of those is what we call diastema. And now diastema means you've got spaces between adjacent cheek teeth. And those spaces can get packed with food material, which then starts to decay and then encourages the presence of bacteria. And that can result in infection of the gum and can be very painful. And those diastema are quite difficult to detect if you just open the horse's mouth without the use of a gag in the horse's mouth and the use of a light source so that you can properly illuminate the teeth. So this is one of the most common things that gets missed unless a really thorough oral examination is done on a regular basis by somebody who has a special interest in equine dentistry. Mm-hmm. And I think equine dentistry has developed hugely, certainly since I was a graduate a long time ago, when people just rasped teeth maybe once a year and nobody did proper oral inspections. There have been huge developments for the better of the horse, I think. And now I think that there are many more people who are specializing in dentistry and are doing a much, much better job for the horse, which improves oral comfort. And I think that that's one of the most important things that we can do on a prophylactic or preventative basis for horses, that just like you have regular vaccinations to prevent infectious disease, you should have regular oral examinations by somebody who has a real interest in horses' mouths, in order to prevent the development of and to recognize these problems and approach them and treat them accordingly.
Yeah, I was just talking to somebody the other day about all the horses I can think of in the past that I worked with, that I wish I could go back with the tools, the dental tools that we have today. You know, we just, I don't even think it's that we didn't know, we just didn't have access. And, you know, now that we can recognize these behaviors, they were just so normalized and so common. And that's, you know, part of the whole discussion is, are things worse now than they were back then? And in a lot of ways, they're not. A lot of ways, they're better because we have these tools.
Yes, and I think that with that, the horse owning public is becoming more educated. And I think that it's important that those of us involved in the equine industry demonstrate to those people outside the industry that welfare is improving in many, many respects. And I think that that's an important point to put across.
Exactly.
And I would also encourage people within the equine industry to not be too critical about what everybody else is doing, because that doesn't help the equine industry as a whole, really. It can be a bit destructive. Anyway, let's go on to the behaviors related to the mouth. The first of which, if we go to the next slide, is the mouth being open with separation of the teeth for 10 seconds or more, or repeatedly opening and shutting the mouth for 10 seconds or more. And it's important that we do see separation of the teeth. You'll have some horses that will roll back their lips, but the teeth remain apposed. They are not separated. Now, I don't think rolling back the lips is normal. I don't think we see that in many truly comfortable horses, but it is not part of the ethogram because it wasn't seen with sufficient frequency to make it part of from the statistical analysis to make it one of the behaviors. But I would say if you repeatedly saw the lips being drawn back to expose the teeth, then I would just make a note of this because I don't think it's normal. So if we look at this horse on the left, this is another horse with an intense stare. The ears are rotated outwards, so that's within the normal range. The head is behind the vertical position, and that's not part of today's discussion, but I just want you to see that this is despite the reins being loose. So this is not the rider making the horse put its head there. It's how the horse has chosen to put its head, which is an important observation.
Mm-hmm.
Let's go to the next slide, because I think when we're seeing the mouth opening repeatedly, we have to always be thinking, why? Remember that each of these behaviors can have more than one cause. So it may be a reflection of musculoskeletal pain. The horse maybe, for example, have a bilateral hind limb lameness, but it could be discomfort created by the bit, or in the case of a double bridle, both bits in the horse's mouth. The bit may be too large. The diameter of the cannons of the bit may be too big for the horse's mouth. And remember that the external dimensions of a horse's mouth do not reflect necessarily the internal dimensions. They're not necessarily proportional. And if a bit is too wide, the bit is more likely to move across the horse's mouth. And if the horse is ridden without a noseband, the bridle is less stable, and that's more likely to result in the bit moving across the horse's mouth, which can create discomfort and encourage the horse to open its mouth. The height of the bit in the mouth may be important, because if the bit is too high, then it's placing pressure on the commissures of the mouth. And if that pressure was excessive, that may create discomfort. So you could question whether or not in this grey horse on the right, whether or not the bit is too high. But equally, we can have problems with the bit being too low in the horse's mouth and constantly banging on the canine teeth or the tushes in a male horse. And that clearly is going to create discomfort. And then we always have to think about the influence of the rider, because if the rider is constantly moving their hands, albeit inadvertently, maybe because they don't have correct balance, if they're moving their hands constantly, that will move the bit in the horse's mouth constantly and potentially create discomfort. If the rider uses excessively strong rein cues, then that may cause the horse discomfort because of pressure of the bit on the bars of the horse's mouth or the commissures of the lips, or both. We always have to think about what influence the tightness of the noseband is having, because if the noseband is very tight, that can itself cause discomfort. And sometimes we will see if we take off a very tight noseband in a horse that was opening its mouth, rather paradoxically, the horse may have a much quieter mouth because the mouth opening was induced by the pressure of the noseband. And although the pressure of the noseband, you could argue, keeps the horse's mouth shut, there are instances when removal of the noseband actually makes the mouth become closed when it was previously open. And then we must always think about what stress can cause, because if you notice horses that are stressed, they will often grind their teeth and they may open their mouths and shut their mouths on a very repeated basis. Even just standing, you put the bridle on and they may constantly open and shut their mouths, which may just be a stress response. So all of these things we have to consider when we're thinking about a horse with its mouth open.
Can you just real quickly talk a little bit about the limitations of measuring some of these things? You talked about the noseband measurement standard that's been implemented. So that's a pretty straightforward example, but we've done talks before about bits and riding bitless and that sort of thing. And you've talked about the limitations of being able to measure the pressure of the bit. And, you know, what are we able to know, and what do we have to sort of approach from a trial and error standpoint, or making some assumptions?
Let's just go to the next slide, because I think we can talk around this slide.
Great.
Because on the right, you can see a horse with a double bridle and a pretty tight crank cavesson noseband, and the mouth is open. There's quite a lot of foam, so it's a bit difficult to see if the teeth are separated, but we can see the tongue is exposed, but it's not out of the horse's mouth. But we can see that this horse has got a fairly small mouth. The commissures of the mouth are quite short. The length of the lips is quite short, and yet it's having to accommodate two bits. And we can see the tension around the nostrils, and we can see that the angle of the curb is at a rather large angle relative to the vertical position. We can measure rein tension, but rein tension is not necessarily equating with the pressure on the structures with which the bit is coming into contact.
Mm-hmm.
And you can clearly see with this horse's mouth partly open that there's obviously pressure of the curb bit on the horse's tongue. But remember that the tongue is effectively a bag of muscle. And if you wear a belt, you often have pressure from the belt on your abdominal muscles, and that pressure doesn't necessarily equate with pain.
Mm-hmm.
So I think we have to kind of think and differentiate between what pressure causes pain, or what pressure can induce, for example, disturbances in blood supply, perhaps, mm-hmm. And what pressure actually causes discomfort. And I don't think we know in real terms. So at the moment, the measurements that have been used in studies that have investigated, for example, the difference between the use of a snaffle bridle and a double bridle, they've looked at the rein tension in the snaffle bridle reins for the horses with just snaffles, and the horses with the double bridle, as we see on the right, they've measured the rein tension in the Bradoon rein and also the curb rein. And when these horses were worked in straight lines, in walk, collected trot, and collected canter, there were not huge differences between the double bridle rein tensions versus the snaffle bridle. So from that study, it was suggested that the use of the double bridle is acceptable. But of course, when you're doing a study like that, you can't take away the potential influence of the rider.
Mm-hmm.
And if the rider has only got to ride in straight lines and it's an upper level Grand Prix rider and just got to do walk, collected trot and collected canter for a few steps down the long side, without it being marked in any way,
Mm-hmm.
they can easily relax their fingers, so there's not much rein tension.
Sure.
So I think there's the potential for huge bias here if you're comparing the same horse ridden in a snaffle versus a double, if it's being ridden by a rider that wishes to protect the use of double bridles. So I think this is a very investigate scientific principles behind it, because there are so many variable factors. It would be very different if we were thinking about the horse riding a Grand Prix test in which each movement was going to be marked, whether or not we would get exactly the same results using the snaffle versus the double bridle. That's a completely different situation.
Mm-hmm.
So we can see in the horse on the left a number of different things. The ears are way forwards. The horse's head is tilted. We can see the exposure of the sclera in the left eye, top right of the left eye. And we can see the mouth is open with separation of the teeth. And also we can see the bit being pulled through to the left side. So multiple things are happening. Now, we can see in the horse with the double bridle that we've got this excessive whiteness around the lips, which makes it difficult to tell exactly what's going on. And although the use of marshmallow fluff has been banned by the FEI, this whiteness, and this was a photograph that was released after the FEI ban, indicates to me that either marshmallow fluff is not being, the use of it is not being controlled, or people are using other things like lots of sugar to create such fluff, because we still see a lot of whiteness around dressage horses' mouths.
Mm-hmm.
Now, obviously, horses normally produce saliva. And let's go to the next slide. And this horse, you can see, has got some whiteness around the lips, and that's due to saliva. Then the question that arises, well, how much saliva is normal?
Mm-hmm.
If there's excessive saliva appearing, drooling from the mouth, is that because the horse has been inhibited from swallowing, related to the head and neck position, or perhaps the tightness of the nose band, or excessive rein tension, or a combination of those? If you just advance one, we can see a close-up of the horse's head, and where you can see this whiteness around the lips. This is nothing like as white as the previous horse with the double bridle. This is a horse which I think this is a reflection of saliva being present at the horse's lips. And I would regard that as a normal amount. And in fact, I often observe that when you remove, for example, pain-causing lameness by the use of nerve blocks, often horses will have a little bit more movement in their mouth.
Mm-hmm.
And often you will see a little bit more saliva at the mouth. And certainly as a rider, you will feel that you will not have the same effective wooden feeling that you had before. Through the reins, you would feel before you took away the pain that the horse was kind of not really reacting to your rein cues, because it was resisting. It was kind of fixing its head against your rein cue. Whereas when you take away the pain, you get a much more reactiveness within the horse's mouth, and often they will chew a little bit more, and you will see more saliva. So I think just to see saliva doesn't mean things are bad. And I think that's really important to recognize. Let's go on to the next slide. We've talked a little bit already about this. I don't think we really need to discuss that anymore. Let's move on to the tongue. So one of the behaviors is the tongue either being exposed, hanging out all the time, or the tongue moving in and out. And sometimes it can be large amounts of the horse's tongue, which is very, very obvious, as you see in these examples. And other times it's much more subtle, and you have to look really carefully, because you'll suddenly see the tip of the tongue pop out, and then it goes in again. And then maybe 2 minutes later, you'll see it pop out again. And again, this is one of the things, because the definition is tongue exposed, protruding, or hanging out all the time, or moving in and out, and that has to be repeated. It's another behavior when I put a little tick in my box to say I've seen the tongue pop out once, then I'll put another tick when I see it happen again. And this can happen very fleetingly, so you really have to be paying attention so that you don't miss this. Let's go to the next slide whilst we're talking about the tongue, is that we've become aware, much more aware in the last couple of years, of the fact that in some horses, and I think it's only been documented in dressage horses, that there has been documentation of blue discoloration of tongues. I think that we now have seen it enough to recognize that it's a true finding, and it's not a normal finding, but we don't yet understand fully what the cause is. Discoloration is usually due to either a change in the blood supply, and that could be restriction of the arterial supply to the tongue, or it could be restriction of venous return, or it could be in some way related to the innervation of the tongue. We really don't know at the moment. Is it induced by excessive rein tension? Is it induced by the fit of a double bridle? Can it occur with just a snaffle bridle? I don't think we know at the moment. The vast majority of the photographs which I have seen depicting this, the horse has had the curb bit being used apparently rather strongly, as we see in this instance. See how snugly the curb chain is compressing against the back of the horse's lower lip. Look at the degree of compression of the corners of the horse's mouth by the bradoon, and look at the tightness of this crank cavesson noseband. It's not a pretty sight, and it's clear that this shouldn't be happening.
Well, and when you say it's difficult to study without inducing it on purpose, which would be unethical.
Yeah, absolutely. So the only way we can determine how to reduce its frequency of occurrence is start taking things away. So if you remove the double bridle and you only allowed horses to use snaffle bridles, and we didn't see any blue tongues anymore, we would have an answer.
Right.
You could put rein tension measurers in the reins, and say that if the rein tension got above a certain level, the horse had to be eliminated. Mm-hmm. That there are various ways that you could start to investigate without creating the lesions. but say, okay, well, let's measure rein tension and see what happens. It's a difficult issue, and it's something that obviously is in the public domain, and therefore something needs to be done.
Absolutely. But it really points out how it's a more complex conversation than do away with the sport because of this.
Oh, absolutely. Yes. I mean, I'm a great believer that I think we can make most horse sports more horse welfare friendly whilst maintaining a good level of competition with ethical training and with the development of a harmonious relationship between the horse and the rider. And I know that there are some groups like the World Bitless Association who are really anti the use of bits and are huge proponents of a bitless bridle. But I think that the evidence currently is not there to say whether or not it is more user-friendly to have a bitless bridle when there may be excessive tension on the horse's nose and potentially other structures of the horse's head versus the bit. I know that there is a group of people in the UK who are recruiting riders who use both bitless bridles and snaffle bits in order to try and do a study. Yes. And I think that's a much needed study to be done, because I think there are many questions that need to be answered about the relative merits or otherwise of a bitless bridle versus a snaffle bridle or a double bridle. Whatever we say about this, I think we have to come back to recognize that it is how any of these pieces of tack are used, and that is the responsibility of the rider. And so the rider has to take responsibility, and I'm sure that the way in which some of these horses are ridden is in part of the problem.
Sure.
Let's go on to the next behavior, which is the bit being pulled through to one side of the horse's mouth on a repeated basis. And in the chestnut horse on the left, the bit is coming through to the right-hand side of the horse's mouth. Now, let's go on to the next slide. I'm often asked, well, surely many riders are right-handed, and therefore the right hand is the dominant hand, so the bit being pulled through is probably due to their handedness. And certainly that may be the case. If we look at this chestnut horse on the left, we can see that the rider's right hand is higher than her left hand, and the right hand is slightly behind the left hand, and the bit has come through to the right. And if you look at the balance of the rider and her upper body position and her lower leg position, I think she's leaning somewhat on the reins. So it's quite possible in this particular horse that the bit is being pulled through as the result of the rider. I think this is another situation when we're going to be thinking about what we need to check before we see the horse ridden, and we need to check what is the width of the cannons of the bit, so we know how much of the cannon of the bit we can expect to see on each side of the horse's mouth. If the cannons are too wide, it doesn't preclude us using the behavior, bit pulled through to one side, but we just need to know how much of the cannon of the bit we would expect to see if the bit was symmetrical in position within the horse's mouth. Now, my observations are that despite the fact that a preponderance of riders are right-handed versus left-handed, we don't see more bits pulled through to the right versus to the left. We see a pretty even distribution of bit pulled through to the right or bit pulled through to the left, which would, to me, would indicate that it's not the result of the rider-handedness. Moreover, when we take away pain, so for example, we take away hind limb lameness through the use of nerve blocks, we will generally see it becomes more symmetrically positioned in the horse's mouth. To me, that the bit being pulled through to one side was due to what the horse was doing with the bit, not what the rider was doing with the bit.
Mm-hmm.
And I often ask the rider, do you have equal rein tension, or is the horse putting more pressure on one of your arms compared with the other? And they will often say yes when the horse has got musculoskeletal pain. And when I take away that pain, they immediately have more even rein tension. So let's now go on to the next slide, because in the next slide, we're going to see the results of a study which was of 150 horses, which were presented for investigation of low-grade lameness or poor performance. And on the vertical axis, we've got the frequency of the display of any of the 24 behaviors. And on the horizontal axis, we've got each of the 24 behaviors. And highlighted in yellow, the yellow box highlights each of those behaviors that we've been talking about today, the facial expressions. And the white bars demonstrate the frequency of occurrence of each behavior before the use of nerve blocks. And the blue bars represent the frequency of each behavior after removal of the pain causing lameness. And we can see that for each of the behaviors that we've been discussing, that the blue boxes are considerably smaller than the white boxes. So that indicates that there has been a very substantial reduction in the display of each of those behaviors that we've been discussing today, indicating to me that there is a causal relationship between those behaviors and the presence of musculoskeletal pain. Because when we take away the musculoskeletal pain, the frequency of those behaviors goes down.
Mm-hmm.
And if we look at the biggest white bar, which represents an intense stare, we can see that more than 80% of the horses before diagnostic anesthesia, before the use of nerve blocks, had an intense stare, and that's reduced to about 25% after the use of diagnostic anesthesia. So the recognition of this behavior is really important. I just now wanted to think about some of the other oral behaviors or mouth behaviors that we might see in a horse with musculoskeletal pain, which are not part of the ethogram, and they're not part of the ethogram because they don't occur with as high frequency of those behaviors as we've already discussed. So if we go on to the next slide and we look at the shape of the horse's muzzle and the tightness of the lower muzzle and the kind of extension of the upper muzzle, that's something that we see not frequently, but we do see, and usually it's associated with musculoskeletal pain. We can also see that this horse has got its lips separated. As I said before, it's important to differentiate between lip separation and teeth separation. Then you'll have some horses which will repeatedly smack their lips. So you will hear an audible sound of the lips smacking, which I think is a reflection of tension. And tension is the result of stress, and that stress is often the result of pain. Similarly, hearing the horse repeatedly grind its teeth is a very good indicator of the presence of pain. In our latest study of those 150 horses that I just showed you the results of, we did document before and after diagnostic anesthesia whether or not the horses were grinding their teeth. And there was a substantial reduction in the frequency of occurrence of teeth grinding when we took away the musculoskeletal pain. So these are all important observations that, whilst they're not part of the ethogram, I think are important observations nonetheless. And then we've got a final picture to show a horse with an engaged look in its eye and its ears forward and its mouth shut and no exposure of the sclera. I think it's really important that we think about what normal should look like and as regards facial features. I would be happy with the facial features of this horse. I would comment that the poll is not the highest point of this horse's neck. The mid-neck is the highest point. And the question then is why? I would also say that the horse is a little bit croup high in this phase of the canter. So I think this horse is a little bit on the forehand in canter. But in terms of its facial expressions, it looks like a comfortable horse. And I think it's important that we recognize or learn to recognize what is normal and what is potentially abnormal. And I think that's about it.
Awesome. I would just jump in here and say, I think we've referred to issues in this talk that were covered in previous lives. We've one about bits and bitting, and then some about some of the other behaviors that we will go back and post on our socials. So if you follow us, we'll be following up with more information if this sort of piqued your interest.
We did have one, I thought, pretty thoughtful question that I know we've addressed this type of thing before, but would probably be helpful for people to hear about. The writer was explaining that she has a horse who kind of always shows his sclera, whether being ridden or not, so can't read that. But he does gape his mouth throughout every ride, whether walking, trotting, cantering in the arena or on the trail. He's opening his mouth, has had imaging of his pole jaw as well as his back and limbs. He's a successful horse and in competition, and so she does teeth, joint injections, body work regularly. Still happening after 5 years. And so she's wondering, can she assume that maybe this is a learned or nervous habit, that this is unique to this particular horse, and wondering if she can assume anything about the horse's personality, maybe being an overachiever, or what she might think about that behavior.
I think if we're seeing only that behavior, and none of the other behaviors of the ethogram, then we can be reasonably confident that it's not primary musculoskeletal pain. I don't think we can necessarily exclude oral pain, but she's obviously had the mouth investigated on at least one occasion. So can it become habit? I think it can potentially become a habit. We know that horses learn habits quickly and they unlearn slowly. Whether there's some underlying tension that hasn't been recognized remains open to question, I think. And I would be very much inclined to play around with the bridle. I would probably try a bitless bridle and see what happened. I would try taking off the noseband. I would try different bits. If it went fine bitless, I would try then, okay, well, if I use a different bit, different type of bit, different material of bit. I was given a leather bit when I was last in Poland, and that is, some horses find much, much more comfortable than a conventional metal bit. So I still think that there are potentially things that could be tried if they haven't already been tried.
Great, thank you. Thanks for answering that. It had me thinking, as a behavior consultant and trainer for many years, we will occasionally see something that we call a stereotypic behavior, or not stereotypic, superstitious behavior, not stereotypic, totally different thing. Superstitious behavior, where when you're training an animal, one behavior that you're selecting for that criteria, they sort of on the side are doing some other behavior. And as far as they know, when you're reinforcing that behavior, they think that they're all part of the same thing. So I think that's a pretty in my experience, it's pretty exceptional to see superstitious behaviors. It's important to be aware of them, but I absolutely agree that investigating what might be going on for the horse as far as possible. And really pleased to see this writer asking all the questions that she possibly can to take responsibility for looking at that behavior. I think it's really to be commended.
Absolutely.
Yeah.
So, our next live that we will be doing next month on Thursday, June 19th, we're going to continue along with this sort of deeper look at some of the 24 behaviors and some that people have a lot of questions about. So we'll be looking at how we interpret the behaviors of the head and neck. So jot that down in your calendars. And get this. I just wanted to also, we've talked about the 24 Behaviors film. If any of you haven't seen the 24 Behaviors film, be sure to go ahead back and watch that. But also Dr. Sue Dyson and Catherine Lauritsen of Padma Video have also put out another film a few months ago that has had great reception as well and really has a lot of information, scientific, evidence-based information that anyone watching this and who enjoyed the 24 Behaviors film will find this very enlightening as well. And again, just a reminder, here at the Train with Trust Project, we have 2 websites that you can find information on, trainwithtrustproject.org and 24horsebehaviors.org. And if you're enjoying these conversations, please do consider a donation to help us keep functioning smoothly. And we're so glad you all joined us. So glad to have you, as always, Dr. Sue, for these conversations that really help people get a great understanding of how they can help their horses by using the ethogram.